Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing a very small topic, that is red and white infarct. So when we start with the topic, so when you hear the word infarct, what does it mean? Infarct means a dead tissue which has not been able to receive blood supply. So lack of blood supply, which is leading to this kind of infarct, and in turn what it does, it deprives your cell from getting oxygen, so that is leading to your infarcts. So it can be red infarct, white infarct. Why the fancy term has been given to it? So see, here what we are seeing is, when you look for this red infarct, so red, as the name suggests, it is hemorrhagic. So whichever organ, so this is a very common topic which you are being asked in your NEET PG entrance or FMG entrances. So this question is very commonly asked, like red infarct is seen in all organs except. So for that you need to know which all organs have which kind of infarct, whether red or white. Correct? So you can see one few pictures I have kept here. Like, to imagine red infarct, you see, as the name suggests, I was telling you, that is hemorrhagic. So this infarct has your red appearance, and white infarct will be always pale, and the red infarct will be always your red, as the name suggests. So where you see it in your ovary, like you can see in your testis, ovarian torsion, testicular torsion. Then you can see in lung. So this is the lung picture. Red infarct, the hemorrhagic area is this one. So this area has not been able to receive blood supply. So it has become dead, now red color. Then sometimes liver also you can get. Liver, sometimes you can see pale infarct or the white infarct also. Then you see intestine. So intestine is also that organ where you can see red infarct. So now coming to your pale infarct, you can see the color is always your whitish. Correct? So this is the area in brain. This is spleen. The second one is your brain. Then you see white infarct in your heart, myocardial infarction. Then you can see in kidney. So these all organ. So basically the solid organs. So this is your solid organs. You have your white infarct, and the organs with your loose tissue, you have your red infarct. So, and more important thing, red white से तो आपको clear हो गया, red है, hemorrhagic है, organs जिन organ में वो loose tissues होते हैं, loose organs हैं, like your lung, intestine, ovary, then testis, then liver. Sometimes, see, liver is also spongy, so sometimes you can get red infarct, sometimes you get white infarct. So loose tissue, loose organs, and here you have your solid organs. Solid organs name is this all: spleen, kidney, brain, and your heart. So these, they have your white infarct, and these have your red infarct. Now few more differentiating feature in red infarct. What you get usually in red infarct, you see that organs, they have dual blood supply, right? Here they have single arterial supply, right? And here there is only single, means arterial insufficiency will be there, single arterial supply, blood supply, and there is arterial insufficiency, fine. And here you have your, in the red infarct, you have your venous insufficiency. So this all organ, just to summarize, red infarct, which organs you see? Ovarian torsion, testicular torsion, you see in lung infarct, intestinal infarction, then liver, sometimes you see red infarct. So all these names suggest the color is your hemorrhagic. Then white, and coming to the white infarct, what you see in white, this is pale. And which solid organs you see? That was a loose organ. This is solid organs like your kidney, spleen, heart, and brain. And coming to your blood supply, the red infarct will have your dual blood supply, and here you will have your single arterial blood supply. Here dual blood supply, the organs, they have your venous insufficiency. Here the organs, they have your arterial insufficiency. So these basic things you have to remember. So bit in detail, just summarize. So just to summarize the whatever we have read. So organs हम कहाँ कहाँ देखेंगे? Question आते हैं ऐसे. White infarct seen in all except, or you can be asked white infarct is seen in. So red infarct, white infarct. So organs is the most important one you have to remember. So like lung, intestines, ovaries, testis. With diagram I have shown you. Color is hemorrhagic. White infarct is your heart, spleen, kidney, solid organs. Then what is the etiology? Cause क्या होता है red infarct का? So lung, small intestine में हमने देखा है dual circulation है. Ovarian torsion में there is a venous occlusion. And sometimes this occurs, this red infarct has been seen in organs where there is sluggish venous flow previously also in the tissues. Now they are coming with this infarction. Then it can also be seen in organs where the blood flow is re-established where previously there was arterial occlusion or necrosis. And white infarct you see because the tissue, the solid organ hai, solid tissue hai, so that will not allow the blood properly to seep through from the adjoining capillary beds into the necrotic area. तो necrotic area में blood नहीं पहुंचता है in solid areas because उसकी seeping of the blood becomes very slow. So that limits the blood supply to the area where necrosis is going on. Then coming to a color change is very common. I told you this is hemorrhagic and this is your pale. Margins, hemorrhagic hai when you see, when we saw in the pictures also, margins are not well defined and in white infarct they are very well defined. Edema is not seen in your hemorrhagic. So edema hai, so just imagine वो swelling हो रही है, edema है और margins उसके ill defined हो गए. Edema नहीं होगी तो margins बहुत ही well defined होगी. So these are basic difference between your red infarct, white infarct. Soon we'll be discussing some few very important topics which are there, which comes in your NEET and FMG exams with MCQs. So thank you very much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Thank you so much.